Well, hello there, future nurses. Welcome back to Med Monday. Let's go ahead, jump in, and get started. So, this week, our featured medication is norepinephrine, or the trade name Levophed. The functional class, it's an adrenergic, and the chemical class, it's a catecholamine. This medication is given via IV. It acts in direct and indirect alpha agonist that causes peripheral vasoconstriction, resulting in increased blood pressure. It also increases contractility, working on the beta receptors in the heart, which results in vasodilation of the coronary arteries. It's an IV infusion, and it is reserved for the critical care setting. The onset is 1 to 2 minutes. It's metabolized in the liver, and it's excreted in the urine. The indication for this, basically acute hypotension and shock. Contraindications include hypovolemia, so we have to have intravascular volume in order for this medication to work. If our patient is intravascularly dry or dehydrated, it doesn't matter how much of this medication we give, it will not have the desired effect, which is increasing blood pressure. It also is contraindicated in mesenteric thrombosis. It's contraindicated in concurrent use of MAOIs and tricyclic antidepressants, as well as halogenated anesthetics. And these are gases that are given in the OR during surgery. Side effects include headache, anxiety, insomnia, decreased urine output, dyspnea, palpitations, tachycardia, and if the tachycardia is persistent and is increasing, typically we will switch to another vasopressor. Angina, hypertension, pain or burning at the infusion site, especially if it's a peripheral line, and decreased peripheral perfusion. So what happens in that case with decreased peripheral perfusion is that it constricts all those little tiny vessels in the periphery. Think in your extremities, fingers, hands, feet, toes, and it will cause tissue damage because it basically clamps those off. Adverse reactions include cerebral hemorrhage, necrosis, and back to that last point in our, let me back up here. Our last point in our side effects, decreased peripheral perfusion, what will happen is your patient can develop necrosis. And so a lot of times with vasoactive medications, not just Levophed, but you will see in the patient's fingertips or their toes, they will start to necrose or turn black. Extravasation, and basically this is leaking of the medication into the tissue, which will cause tissue necrosis because it will vasoconstrict everything, and it can get pretty ugly. I've seen some pretty bad extravasations. And anaphylaxis. So nursing considerations, this medication does have a black box warning, which is extravasation. Patients can lose a limb if this leaks into the tissue and is not caught on time. What we do give for that is Regitine, and it is injected into the area around the infiltration, and it works on counteracting the Levophed. So this medication should be administered via a central line. However, in cases of emergency, it may not be, and so you will have to watch that site very closely. We also want to monitor our patient's heart rate for tachycardia. We want to monitor our blood pressure every 15 minutes at least, but more often if we are titrating. We also want to monitor the site for infiltration extravasation, We want to monitor our patient's intake and output and notify the physician if the output is less than 30 mLs an hour. We want to monitor our peripheral pulses, color, and temperature because it can cause that vasoconstriction in those extremities. We want to confirm IV compatibility. So if we're going to be connecting our line to any other infusions, we want to make sure that those infusions are compatible. And we want to monitor our hepatic and renal function. And we do want to protect this medication from light. Our patient teaching includes teaching them about the medical condition that is requiring this medication. We want to teach them how the medication works and potential side effects. We want to instruct them on the monitoring protocols, that they will be hooked up to a monitor so we can monitor their heart rate and rhythm, and that we will be taking frequent blood pressures. And we want to teach them signs and symptoms of extravasation so that if they start to notice something peripheral in their line, that they can let us know immediately. So this week we do have a challenge question, and the question is, your patient is hypotensive due to sepsis. The physician orders norepinephrine to start at 0.5 mics per kilo per minute with a maximum dose of 4 mics per kilo per minute to maintain for a MAP of 65. The pharmacy sends you norepinephrine 4 milligrams in 250 mLs D5. How many micrograms per ml are in the bag? Go ahead and leave your answer in the comments, and the winner will receive a $25 Amazon gift card. So I hope you guys have a great week and keep working on your dream.